What is colistin? Properties, pharmacology, and indication for colistin. Interesting about science and medicine prepared by editors of a channel all scientific. What is colistin? Colistin is an antibiotic from the Polymyxin group used to treat severe infection caused by gram-negative bacteria. It also known as Polymyxin E. Colistin belongs to the class of cyclic cationic lipopeptide antibiotic that exhibit pronounced bactericidal activity. The basic chemical formula of one of the active components colistin A is C53H100N16O13. The colistin molecule has a complex structure including a cyclic decapeptide ring, a linear peptide fragment, a hydrophobic fatty acid tail. The peptide portion contains alpha-gamma demonobutanoic acid residue which carry a positive charge. This makes colistin a polycationic compound. This structure makes the molecule amphiphilic, means it contains both hydrophilic and lipophilic regions. Amphiphilicity plays a key role in the antibiotic's ability to interact with bacterial membranes. Why is colistin sodium used? In medical practice, colistin sodium, a prodrug form of antibiotic, is more commonly used. After administration, it hydrolyzes and converts into active colistin. Chemical properties of colistin. Polycationic structure. Colistin has a number of unique chemical properties that determine its biological activity. Polycationic structure. The presence of several amino groups makes the molecule positively charged at physiological pH. This ensures strong electrostatic interaction with the negatively charged components of a bacterial cell's membrane. Chemical properties of colistin. Amphiphilicity. The molecule contains a hydrophilic peptide moiety, a hydrophobic fatty acid tail. This structure resembles surfactants, allowing colistin to act like a biological detergent. Chemical properties of colistin. Binding to lipopolysaccharides. The antibiotic's primary target is lipopolysaccharides LPS in the outer membrane of gram-negative bacteria. Lipopolysaccharides contain negatively charged polyphosphate groups. Colistin displaces the stabilizing calcium-magnesium ions that bind LPS molecules together. This leads to distortion of the membrane structures. Chemical properties of colistin. Impaired membrane permeability. After binding, the hydrophobic tail of colistin is inserted into lipid layer. The membrane becomes unstable, leading to ion leakage, release of intracellular metabolites, destruction of a cellular structure. This results in rapid death of the bacterial cell. Physical properties of colistin. Colistin is a white or creamy yellowish powder. Main physical character is high molecular weight, approximately 1155 daltons, good solubility in water, poor solubility in organic solvent, hygroscopicity, sensitivity to temperature and light. Colistin solution gradually lowers potency, so they are usually prepared immediately before use. Similar drugs to colistin. Colistin belongs to the Polymyxin family. This group includes Polymyxin A, Polymyxin B, Polymyxin C, Polymyxin D, Polymyxin E, colistin. The most widely used are Polymyxin B and colistin. These antibiotics have a similar mechanism of action and spectrum of activity. The history of discovery of colistin. Colistin was discovered in 1147 by Japanese scientists. The antibiotic was isolated from the soil bacterium Bacillus polymyxacolistinus. In the 1950, the drug was usually to treat bacterial infection. However, its use later declined to the several toxicity. The decline and revival of colistin. The main problems were related to nephrotoxicity, neurotoxicity. At the end of the 20th century, interest in colistin declined significantly. However, since the beginning of the 21st century, the drug has regained popularity to the spread of a multidrug-resistant bacteria resistant to most antibiotics. Today, colistin is considered a last-line antibiotic. Bacterial susceptible, sensitive to colistin. Colistin is active primarily against gram-negative bacteria with an outer membrane. Susceptible microorganisms include Pseudomonas aeruginosa, Actinobacterium baumannii, Klebsiella pneumoniae, Escherichia coli, Enterobacter, Salmonella, Shigella. These bacteria often cause severe hospital-acquired infection, especially in patients in intensive care units. Colistin-resistant bacteria. Some bacteria are naturally resistant to colistin. These include Proteus, Morganella morgani, Serratia marchescens, Providentia, Bucloria scepacea, Furthermore, colistin has virtually no effect on gram-positive bacteria and anaerobic microorganisms. This is due to the structural features of a cell membrane. Bacteria characterized by resistant bacteria. In recent years, colistin resistance has become a serious medical problem. The MCR gene. In 2015, the MCR1 gene, which encodes the enzyme phosphoetanolamyxin transferase, was discovered. This enzyme modifies lipopolysaccharides in the bacterial membrane, reducing the ability of colistin to bind to them. A unique feature of the MCR gene is that it is located on plasmids, allowing it to be transmitted between bacteria. Mutation regulatory system during interaction with colistin. Resistance can also rise due to mutation in the regulatory systems. PHOP, PHOQ, PMRA, PMRB. These systems control the synthesis of a cell's membranes, components, and can alter its structures. For what disease is colistin used? Colistin is used to treat severe infections, hospital-acquired pneumonia, sepsis, urinary tract infection, skin and soft tissue infection, meningitis, respiratory tract infection in cystic fibrosis. The drug is especially frequently used in intensive care units. Alternative to colistin. Alternative antibiotics include carbapenems, aminoglycosides, tigecycline, fosfomycin, new beta-lactam agent. However, for infection caused by extremely resistant bacteria, colistin may remain the only effective drug. Contraindication for colistin. Colistin is contraindicated in hypersensitivity to polymyxin, severe renal failure, myasthenia. The drug should also be used with caution during pregnancy in patients with neurological disease. Colistin side effects. Rash. Allergic reaction may manifest as skin rash, itching, redness of the skin. Side effect of colistin. Intestinal dysbacteriosis. The antibiotic may disturb the normal intestinal microflora. Possible symptoms: diarrhea, dysbiosis, digestive disorders. Nephrotoxicity and neurotoxicity of colistin. Colistin can accumulate in renal tubular cells and cause damage. Neurotoxicity. Possible symptoms: dizziness, weakness, paresthesia, respiratory dizziness. Pharmacokinetics. Introduction of colistin. Administration. Colistin can be administered intravenously, intramuscularly, by inhalation. Oral use is limited due to poor absorption. Distribution of colistin in the body. After administration, the drug is distributed into body tissue, to lungs, liver, kidneys, muscle. However, penetration into cerebrospinal fluid is limited. Excretion of colistin from the body. The primary route of elimination is through the kidneys. Colistin-metated sodium is excreted primarily in the urine. The half-life is approximately 3-5 hours, but may be prolonged in the renal insufficiency. Dosage forms of colistin. Colistin is available in the following forms: powder for injection solution, inhalation solution, powder for infusion. The most common form is colistin-metated sodium. Storage of colistin. The drug should be stored at a temperature not exceeding 25 degrees Celsius. In a dry place, protected from the light. Solutions are recommended to be used within a short time after preparation. Molecular mechanism of bacterial membrane disruption. The mechanism of action of colistin has been studied for a long time by microbiologists and biochemists. It is currently believed that the antibiotic acts through a multi-step mechanism associated with disruption of a cell membrane structure of gram-negative bacteria. Electrostatic interaction of colistin. The first step is the electrostatic binding of colistin to lipopolysaccharides LPS of a bacterial outer membrane. Lipopolysaccharides contain negatively charged phosphate groups. These groups are normally stabilized by the valent cation, calcium, magnesium. The positively charged amino groups of colistin compete with these ions and displace them from the membrane. As a result, interaction between lipopolysaccharide molecules are weakened. Destabilization of a water membrane with colistin. After the stabilizing ions are displaced, the membrane structure becomes unstable. The hydrophobic fatty acid tail of colistin is inserted into the lipid layer of a membrane. This leads to increased membrane permeability, pore formation, impaired cell barrier function. Damage of cytoplasmic membrane by colistin. After disturbing the outer membrane, the antibiotic reaches the inner cytoplasmic membrane. Here it acts as detergent. It disturbs the lipid bilayer. It causes ion leakage. It leads to the release of intracellular metabolites. This results in osmotic imbalance and biological cell death. Additional effect of colistin. Modern research has shown that colistin can also cause other effects: the formation of reactive oxygen species, disruption of a bacterial respiratory chain, inhibition of certain enzymatic processes. These processes further enhance the bacterial effect of a drug. The structure of lipopolysaccharides and the role of lipid A. To understand the mechanism of action of colistin, it is important to examine the structure of lipopolysaccharides, LPS. Lipopolysaccharide consists of three main components: lipid A, core oligosaccharide or antigen. Lipid A in the hydrophobic portion of a molecule embedded in the membrane lipid layer. Lipid A is the primary target of colistin. It contains phosphate groups, fatty acid residue. The positively charged amino group of colistin binds to phosphate groups of lipid A. This leads to the disruption of a membrane structure. Many mechanisms of bacterial resistance to colistin are associated with a modification of lipid A. Use of colistin in veterinary medicine. Colistin has been widely used not only in human medicine but also in veterinary medicine and agriculture. For many years, the antibiotic has been used to treat infection in farm animals, to prevent disease, and sometimes as growth promoter. Colistin was particularly actively used in pig farming, poultry farming. However, the widespread use of antibiotics has led to the emergence of resistant bacterial strains. In 2015, the MCR1 gene associated with resistance to colistin was discovered in China. This gene was detected in bacteria isolated from animals, meat products, patients. Following this, many countries began restricting the use of colistin in agriculture. Modern research on colistin. Despite its toxicity, colistin remains an important antibiotic. Therefore, active research is currently underway to reduce the drug's toxicity, improve the pharmacological properties, create new polymyxin derivatives. New polymyxin derivatives. Scientists are developing modified polymyxin molecules that have less nephrotoxicity, retain antibacterial activity. Some of these are already undergoing clinical trials. Combination therapy with colistin. In modern medicine, colistin is often used in combination with other antibiotics. The most common combinations are colistin and carbapenems, colistin and tigecycline, colistin and rifampin. This therapy allows to increase treatment effectiveness, to reduce the risk of resistant development. Liposomal form of colistin. One area of research is the development of liposomal formulation of colistin. Liposomes allow delivering the antibiotic directly to site of infection, reducing toxicity, increasing drug concentration in the lungs. This formulation is particularly promising for the treatment of respiratory tract infection. The importance of colistin in modern medicine. Colistin plays an important role in the fight against infection caused by multidrug-resistant bacteria. In recent years, bacterial strains resistant to actually all antibiotics have become increasingly common. These pathogens include carbapenem-resistant Klebsiella pneumoniae, multidrug-resistant Acinetobacter baumannii, resistant strain of Pseudomonas aeruginosa. In such cases, colistin may remain the only effective drug. Therefore, the World Health Organization classifies polymyxin as critically important antibiotic. Thank you for your attention. This material was prepared by the of page All Scientific. Attention, this material is for information purposes only. When observing very unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.